get started with the press conference for the Johnson County Emergency Operations Center for Friday, April 3rd. I'm Kelly Andreessen, Public Information Officer for Johnson County. Thank you for those in the media reporting on this, to our community partners who are participating, and for those who are tuning in online. Just a few reminders, we are working with an American Sign Language interpreter for this press conference, so reporters, please make sure you're including them in your shot. We are streaming this live on Facebook on the Johnson County Public Health page, and for those purposes, we do have microphones. So for our reporters, if you have a question, please step up to the mic, state your name, affiliation, and ask the question so we can pick it up on the audio for those listening remotely. We are practicing social distancing, so we have limited the number of folks in the room. And for those purposes, I will bring in each speaker one at a time. After they've given their statement, we'll open it up for questions for that individual. And if you do have any follow-up questions after they've given their statement and answered questions, just touch base with me and I can get you in contact. As all of you know, this is a rapidly changing situation, so we are sharing the information that we have at the time, and thank you all for your flexibility and your patience. At this time, I will open it up to Dr. Teresa Brennan from University of Iowa Hospitals and Clinics, and she's joining us via Zoom, so she will give us the statement. And again, for those reporters, if you have a question, please step up to this mic and talk to Dr. Brennan when you have your question. All right, Dr. Brennan.
Great, thank you. Good afternoon. I have a few prepared remarks that I'll give, and then I'm happy to take questions. First of all, an update on our inpatients. At this moment, we have 7 inpatients in our hospital. We've had a total of 8 patients since the onset of the outbreak who have been hospitalized at UIHC and subsequently successfully discharged. I want to tell you some good news today. So we have, for the last many weeks, been working with a program. A home treatment team has created a virtual hospital for our patients so that they can get the best care in the best place at the right time. The goal of this program is for us to follow and provide treatment to patients who are outpatients in their home, hopefully to try to keep them from having to come to the hospital. And it's been a very successful program. All of the patients remain quarantined at their home. They have a kit that is delivered to their house so they can monitor their blood pressure and their oxygen saturation and their heart rate. Each day, either a nurse or a physician, depending on how the patient is doing and what acuity they are, give the patient either a phone call or have a video visit with them to talk about how they're doing, make sure that they know what symptoms to watch for that might require them to be hospitalized or get more treatment. And that's been very successful. To date, we've had enrolled 76 total patients in this virtual hospital program. 35 of them have successfully recovered, and we're presently monitoring 38. Of those patients, 3 have had to come to the hospital for further treatment. So if you look at the international data, it would suggest that 20% of patients get hospitalized. And you can see that with this program, we've been to date successful in keeping that number much smaller. As a result, we're really excited that the patient can receive care in the comfort of their homes, and that we can intermittently speak to them about how they're doing and how they can treat themselves at home in order to prevent themselves from getting worse and having to be hospitalized. Some lessons learned from this are that the patients tend to get dehydrated. Some of the patients will have loose bowel movements, and they will also have a phenomena of a bad taste in their mouth, which really prevents them from eating or drinking. And so part of this program is really about coaching them and encouraging them to eat and drink and making sure that we're following their blood pressure and their heart rate to know if they're doing a good job at that. With this, hopefully we keep them out of the hospital. Because of these positive results, we're actually sharing this with our UIHC staff and family, as well as now with you, so that other institutions can actually adopt this practice and hopefully help us to keep patients in their home getting the right care that they need, knowing when the patients need a higher level of care, and we can then be prepared for them to come into the hospital and hopefully then not stressing the healthcare system. So with this, we have the ability to take care of the patients in the hospital that they need, whether that patient needs a general unit bed or an ICU. Happy to take questions. Thanks so much.
Hi, Dr. Brennan. Lee Hermiston with the Gazette. Oh, I'm sorry. Oh, sorry about that.
No problem.
Hi. Lee Hermiston with the Gazette. Could you tell us a little bit about how patients are determined to meet the threshold for this virtual program?
Yes, great question. I should have told you that before. So these are patients who we would qualify as our patients, meaning that they came to us with their symptoms. We tested them and we made the diagnosis of COVID-19 in that patient.
Hi, Dr. Brennan. Emily Chavez with KGAN. How many inpatients did you say that you had at UIHC?
So right now we have 7. I think we reported in our new news today that we had 6 at midnight last night, but we now have 7.
Great. Thank you so much for the clarification.
You bet. Thanks so much.
Hi, I'm Marissa Payne with the Daily Iowan. Can you clarify how this program might have differed from existing telehealth services that the hospital offered?
Yeah, the video visits that we started when the outbreak started were really to help with diagnosis and early treatment in patients that developed advanced disease from the start. So the influenza-like illness clinic, now we're referring to it as the respiratory care clinic, was really about diagnosis. This is really about treatment after diagnosis. So once the patient has a positive test result, they have COVID-19, then we enroll them in this program so that we can keep an eye on them and make sure that if there are things that we can have them doing at home, that they get that advice and we can actually see them daily and make sure they're following it.
Okay, and there's been a lot of conversation this week about the Iowa Department of Public Health metrics being used to determine a shelter in place. And I know previously Dr. Jackson has urged no shelter in place, fearing the impact that would have on the supply chain. So having seen those metrics, is there any change from UI Healthcare's end on that recommendation against a shelter in place?
Yeah, I would say that shelter in place, of course, is a legal decision, a governmental decision. Dr. Jackson has given an opinion regarding the supply chain, which of course we need to continue to get supplies so that we can take care of COVID-19 patients and our other patients. There's been no change in that recommendation from the leadership.
And there's also been talks about the projected more than 1,400 deaths because of the University of Washington Health Metrics and Evaluation Institute model. And I know the hospital's been preparing the surge plan. Has that data been factored into that at all? Or what are you looking at as you continue to prepare the surge plan?
Yeah, so really good question. Thank you for asking. When we prepared our surge plan, we looked at various models of low penetrance of COVID-19 versus high penetrance of COVID-19. We looked at several different models that have been proposed throughout the nation and the world to anticipate how many patients we might have. And so I think with that, we feel like we're preparing for what could happen. Does that answer your question?
Yeah, thank you.
Yeah.
Hi, Dr. Brennan, me again. Sorry, Emily Chavez with
Welcome back.
KGAN. Thanks. Emily Chavez with KGAN. So I know recently the Trump administration is now starting to kind of do guidelines on recommending most Americans to wear some sort of face mask, whether that be T-shirts or bandanas. I was just wondering, what is your recommendation, or how do you think? Yeah, what does UIHC kind of think about this?
Yeah, so personal protective equipment is a very hot topic. We continue to follow the CDC and WHO guidelines about what is recommended from the standpoint of mask or face shield. We await a formal recommendation from the CDC. I know the president had spoken about options, but the recommendations have not come out yet. From our standpoint, for our employees, what we have done is invested in a number of face shields. We think that face shields are a great option because it covers your eyes. It also covers your mouth to some extent and nose. It also prevents you from touching your face. So I had clinic the other day and I wore one. And it is really hard to touch your face because you have to get up under the mask, which is actually a very positive thing. We continue to have conversations about in routine care, not with the COVID-19 patients, but within routine care, whether a mask added has benefit, whether a homemade mask added has benefit. And our hospital epidemiologists at this point do not feel that it does. Things have changed daily since this outbreak began, so it is possible that recommendation would change. We await the CDC's recommendation.
Great, thank you so much.
You bet.
Hi, Dr. Brennan. It's Travis Breeze with KWWL. On Tuesday, you told us that the hospital was looking into platelet or plasma treatments, I think, for
Yes.
patients who had recovered. Do you have any update on that today, possibly?
So I know that the team has progressed in creating and getting the protocol approved, and they're in the final stages of that. We, at present, do not have any patients that are eligible to provide convalescent plasma, but we hope that within the week we'll be able to do that. So the protocol is being formalized and finalized, and those approvals are well underway.
So it would be fair to say that you have started to look at what the procedure would look like, but you haven't done any tests yet. Would that be true?
It's fair to say that we have the procedure well outlined, and that we have not delivered plasma to anyone yet because it's not available, and we need all of the steps to fall in place. But our hope is to have that available early next week.
Can you say if you've had any other hospitals or institutions reach out, possibly being interested in it?
We haven't to date had anyone reach out. I can tell you that the chief medical officers of the region, the corridor, are meeting twice a week, and we are having conversations about that. They haven't reached out in particular, but they do know that we are pursuing this and will be offering it.
Thank you.
You bet.
Dr. Brennan, we have a few remote questions from Zachary Oren Smith with the Press Citizen.
Sure.
First question. My question is related to the 12-point criteria made public Wednesday by the Press Citizen that is linked with evaluating if or when you proceed with a shelter-in-place order. Were you or UIHC consulted about the metrics used and to what extent? And if so, when were you consulted?
I was not consulted, and I don't have information about whether we were or not.
Okay.
Well, we could certainly follow up with Zach if we were.
Okay. And then the second question, the governor's recommendations still allow for gatherings smaller than 10. Given the evidence of asymptomatic responses, do you endorse this recommendation?
So I hope they have a big room if they're going to put 10 people in it, right? I mean, the recommendation is to isolate when possible, and when you're in places with other people, to maintain that 6-foot social distancing. So I suppose you could have a room that's large enough to have 10 people in, strategic locations where they are maintaining social distancing. Yeah.
All right.
There are certain places where people have to gather. I mean, I would say that this event is one, right, where gathering is necessary, but, to make sure that you have that distance is really important.
Great. Thank you.
You bet.
All right, Dr. Brennan, it looks like we have no further questions for you. Once again, thank you for being available for us, and we'll see you again soon virtually.
Great. Thanks so much. You all stay safe, please. Have a good day.
You too. All right, now I will hand it over to Margaret Reese, Public Information Officer for Mercy, Iowa City.
Good afternoon, everybody. Thank you for having me again today. I'm going to start, as I always do, by asking people to please do everything they can to prevent the spread and follow all of the guidelines. As Dr. Brennan was just saying, to isolate at home if possible, stay at home, keep that 6-foot minimum distance, very small gatherings of people if essential, washing hands, and so forth. It's really critical, and it's something that we can all contribute to. I wanted to say that the telehealth program that we have started at Mercy as of last Monday, March 30th, our telehealth visits now total more than 1,300 since Monday of last week, which is extraordinary. We have 25 primary and specialty care clinics scattered about 5 counties, and our specialists do outreach as far as Missouri to the south and east and west of Johnson County. So being able to have visits via telehealth has been a huge help to our patients. And we are also now providing telehealth visits through our Mercy Behavioral Health Clinic, which is a wonderful new service. This is, as we all know, a very stressful time for everyone. For many, this is a time of fear or isolation. Abrupt changes to child and elder care needs. Families are suddenly homeschooling for the first time and all together 24/7. There is a great deal of economic uncertainty and more, so caring for emotional health and managing stress is vitally important. And we're very glad that we are now able to support others with telehealth visits in addition to over the phone and in person. So it's a very helpful option at this time. And staying home, which is what we're asking everybody to do, can lead to some other health problems. So I just wanted to point out that it's very important to keep moving even if you are at home. So get up and move around. Do exercises, use your treadmill, exercise along with routines, that's right, and routines online, walk laps in the hallway, and maybe you also read over the weekend about 2 individuals in other countries who completed marathons in their apartments, one who had a 28-foot balcony and just went back and forth many, many times until he had completed his 26 miles. And he proved that being confined at home is no reason not to be moving. And if you can't do that, you don't have to do that. But sitting around at home for too long is like sitting on a plane for too long, and it can lead to blood clots and other problems. And we're starting to see some of that in our patients who are staying home. So please get up and move around frequently in whatever way is safest for you. This is day 26 of our response at Mercy, following the first patients to arrive at our hospital with symptoms. And I would like to point out again that we are in need of fabric face coverings. We're starting to call them face coverings instead of masks. We're using the term mask to apply to those medical surgical N95 masks, and face coverings are other types of devices. And we really appreciate the community sewing the homemade face coverings for us, and we appreciate those donations. The instructions and directions for donating them are on our website. We are also now starting to make our own isolation gowns. We are in short supply with isolation gowns, even though we are receiving some, but not as many as we need, and not as many as we would like to have in case we do have a surge in the next few weeks. So we have started to make some ourselves, and we have successfully tested sterilizing them in our central sterilizing department, and we're grateful for that, and we appreciate all the donations that we are receiving from businesses and individuals throughout the community. Are there any questions?
Yes, we have a remote question here from Beth Malicki of KCRG Channel 9. Do your doctors support a shelter-in-place order?
I think that we have many providers who would feel that that's a safe thing to do, but obviously we're going to follow the direction of the governor and Iowa Department of Public Health.
Another follow-up question here from Beth. Do you know where any of the doctors at Mercy asked about the shelter-in-place policy by the governor's office?
Do I know if any of them have asked about that, or
Have been asked for input on that from the governor's office?
I'm not aware of that, no.
And the last question Beth has is, how many ventilators does Mercy Iowa City have?
We have a total of 28.
Thank you.
You're welcome.
Travis Breeze with KWWL. Can you specify, of those 28, how many were on hand before the outbreak, and maybe how many have been donated or given to you by emergency management?
I think we've received 12 additional ones since this has started.
Did you or can you give us an update today on how many people you have inpatient being treated for COVID-19?
As of 8 o'clock this morning, we had 4 inpatients, and we had 2 who were pending in terms of test results. They were in the hospital, but we were still waiting for test results.
You are still... That's my last question, sorry.
Hi, Marissa Payne with the Daily Iowan. I was wondering, because Abbott's been developing quick testing, I was wondering if Mercy was going to get any of those tests, or like what other options for expanding testing.
We're actually going to find that out this afternoon, and probably are finding that out right now as we talk. I know that our director of the laboratory was going to be involved in a phone call about that this afternoon.
Okay. And beyond Abbott, is there anything else that you're working on to develop testing?
We are working with the State Hygienic Lab, and we are also working with one other lab, Quest, which is a national lab. So we have tests going to both of them, and we determine where the test should go based on the needs of the patient.
Okay. Thank you.
You're welcome. Okay, thank you very much.
All right, next up, we have Dave Coach, Director of
Improve your sleep and reduce anxiety, which we all need right now. And going forward, we need this more than ever. People with pre-existing mental health conditions should continue their treatment and be aware of new or worsening conditions. Children and teens also need help coping during this time. It's important to maintain a regular schedule for them. To those who are helping with this response, the physicians, healthcare providers, and first responders, also make sure to watch for symptoms of traumatic stress, including physical fatigue and mental withdrawal. Allow time for you and your family to recover and take a break from the media coverage. Remember, the best way to protect yourselves and prevent getting sick is to avoid being exposed in the first place. Staying home is the safest thing for everyone. Do not invite others, adults or children, into your home or your yard. Please take time to explain this importance to your children as well. Social and physical distancing can feel isolating and stressful, especially at a time when, as Iowans, we are ready to get outside, enjoy the nicer weather, and in April, all of the holidays that are upon us. Postponing or canceling a religious celebration, a wedding, or other gathering is incredibly sad, but we need to think about older adults, those with underlying health conditions, and those healthcare workers caring for the sick. We all need to do our part to protect them from COVID-19. Thank you to all Johnson County residents who are doing your best to protect our most vulnerable friends, family, neighbors from this virus. So at this time, I'll take any questions that you may have.
Hi, Emily Chavez with KGAN. So it's been 14 days since the COVID incubation period, since Iowa Public Health said that they expected a spring break increase in the number of positive cases. Do you think this is the end of that spring break uptick, or?
That's a great question. You know, as the University of Iowa and other universities have canceled classes or have implemented distance learning, we don't have the number of students here, obviously, and I think that has certainly helped. You know, if they were traveling on spring break and coming back, there may be more cases across the state where those individuals live. But I think it was a good decision, obviously, to have people distance and isolate themselves.
Great, thank you.
Travis Breeze with KWWL. I think the last time that we talked about closing Johnson County playgrounds was last Friday. I don't know if it's come up since then. I believe Rod Sullivan told us last time that the county did not believe that it was necessary. Do you know if that has changed?
That has not changed. Yes, I think the county is doing a good job monitoring the playgrounds, and people that are visiting the parks are using the trails, which we encourage to do. We really do encourage people to get outside. I think it's a mental and physical importance to do that with 6 feet distancing between individuals. So again, I think I shared last time when I've been outside on trails, people are really good about getting off to the sides and onto the grass when you're meeting or passing someone.
So, has anybody called in, or have any county workers that you know of observed any parks that like have too many people in them?
I have not heard of any reports like that, no.
Thank you.
Randy Dirks, KCRG TV. This is about businesses that have employees that are getting the virus, and then kind of with the HIPAA and the privacy protections, we get a lot of viewers who are kind of wondering why shouldn't the public get a clear picture of where illnesses are happening, and if the health departments are not able to alert businesses if an employee has COVID-19 and they're only finding out because the employee tells them. Can you kind of clear up what?
Sure. That's a good question, and I think what we have to understand is we're no longer in the prevention, but in the mitigation phase. So what that means is there's widespread community spread of the virus. So to protect those individuals' privacy through HIPAA, there's really no benefit in sharing that information because it is so widespread right now. that that's not a public health importance to share any information like that at all.
Okay. Should employees or members of the public be more or less fearful of going into any of these businesses where they learn that an employee had?
Well, any of those businesses that perhaps had a positive COVID employee, that individual is home. They're isolating themselves for the recommended time frame. They don't come back to work until they meet all three of those criteria that we've shared before. At least 7 days past first onset of symptoms, 72 hours without a fever, and 3 days with those symptoms improving. So there really should be no concerns. Again, the virus is widespread. I think we need to take every precaution that we can to social distance, assuming that this virus is widespread in the community.
And one last one. UIHC is publishing number of people hospitalized on their website. We're finding Lynn County not doing that for us. And then I guess in New York, they're identifying cases by zip codes. Where are you kind of on that kind of idea for?
Well, that's a decision by every healthcare institution and hospital. The state is reporting all hospitalizations across the state on their website.
Okay.
Hi, Marissa Payne with the Daily Iowan. I was wondering if, like the triggers that you've talked about before in determining whether shelter in place was necessary, are those like the same metrics that were in the Iowa Department of Public Health memo dated March 24th and that the press citizen reported on this week's?
Yeah, so I know there's a lot of questions about the metrics and how they were developed and who was involved. Those metrics are a tool, and you've heard Dr. Padati talk about that. That's a tool to be able to help guide and drive decisions. There's many other factors that the governor takes into account before issuing any kinds of closures that she has been, and she's been very clear about that. I think we all want to make decisions based off data, and that's what those metrics help to do.
And would you be able to share like county data under those metrics with like the long-term facility outbreaks, the population, like all those different metrics?
Well, to answer that question, we don't have any outbreaks, long-term care facility outbreaks in Johnson County. We are analyzing data, just like the state is, multiple times a day. They're getting that information in from across the state. So we're taking a look at that. We have a daily briefing with all of our community partners, so we're getting that information as well. So collectively, those decisions aren't made unilaterally or by one agency or organization. And really without the ability to issue any local mitigation strategies. You've heard the governor say that at this point she's not delegating that authority. We still use those metrics, as Dr. Brennan suggested earlier, for surge capacity and those types of things.
And could you say whether the supervisors are still asking Governor Reynolds to delegate that authority to counties, since the Iowa Department of Public Health metrics break the state up like by region?
The Board of Supervisors did submit a letter, and they have not received an answer, and their position has not changed.
Okay, thank you.
We have a few additional questions here from Kate Payne with the Iowa Public Radio. Her first question is, the Iowa Board of Medicine unanimously called on the governor to issue a shelter-in-place order. Does Johnson County Public Health support this?
So Johnson County Public Health, along with Johnson County Board of Health, really support making any decisions based off data. And that's really what we recommend and would support.
Okay, a follow-up question she has here. Johnson County officials and physicians have been critical of the state's metrics for when to issue a shelter-in-place order, saying they're too restrictive and require more outbreaks at nursing homes. Does the Johnson County Public Health think these metrics are sufficient to protect Iowans?
I think what that question demonstrates is the understanding of how complicated this entire event is. So I appreciate the question and their understanding of this. We are doing everything we can locally and across the state to protect Iowans. We are taking our guidance from Iowa Department of Public Health and the governor's office. And those metrics, just remember, in and of themselves, they don't protect Iowans. They are a tool to guide decision making, and so that's what really we need to think of them as another point to help the governor make decisions on protecting Iowans.
And to the same point here, what role does the Johnson County Public Health have to encourage the state to reassess these metrics, if any?
Yeah, that's a good question. I don't know if we have a role. We are in constant communication every day with Iowa Department of Public Health. And so I don't know as if it's our role to encourage them to look at those metrics. I think there's open discussions. They ask us what is important to us in our counties, both Johnson and Lynn counties. So I think if there's any feedback, that's happening through our daily conversations.
All right, last question from Kate here. She says, what disease modeling or projections is the county relying upon to estimate cases that are occurring here in Johnson County?
Yeah, another good question. A difficult one to answer. The modeling questions, I think, have been addressed a little bit before. Even Dr. Brennan today addressed that a little bit on surge capacity and how they determine the level of surge capacity depending on how the virus has penetrated the community. So we are continually assessing the local data. Our demographics, we've certainly looked at our demographics compared to other communities, other states in the United States, other countries in the world. And there's really, I don't know as if there's one model. I mean, there's certainly models coming out from public health institutions across the country that do this on a regular basis. And so, again, we will look to Iowa Department of Public Health and CDC for our guidance.
Thank you.
Great. Thank you. Oh, one more. All right.
Travis with KWWL. It can be difficult for the public or the media to try to calculate hospital percentages because, like here, the hospitals may say we have X amount of people being cared for inpatient, but they may have been, driven in from a different county. If you know the local data a little bit better, could you just tell us what you've seen and what you feel about the rate of hospitalizations for Johnson County patients?
We don't actually get the information from the hospitals depending on which county those inpatients are from. So that would be a question for the hospitals.
So then can I ask, how do you guys calculate hospitalization percentages in the county?
So we don't calculate that necessarily. Our disease prevention specialists have a very detailed list of every resident in Johnson County that is tested positive because we do those follow-up investigations with those individuals. So I don't know if that answers your question exactly, but what I'm trying to get to is that information that we have that we're tracking those positives, again, may or may not correlate with the data that the hospitals have.
So you're saying that you guys are tracking each patient's progress kind of unilaterally, but may not be comparing them in a database together?
Well, I don't know if I completely understand where you're going with this, but as far as the 83 positive cases that we have, we understand very well where they're at. If they're at home recovering, we have constant communication with those individuals. As you mentioned earlier, the hospitals do have patients from other counties that we're not tracking, so that data may not exactly line up.
I mean, looking at the 83 cases that you've been a part of, can you say, does their rate of hospitalization, is it what you had expected, or does it worry you in any way?
I don't have that exact rate of hospitalizations out of those 83 in front of me. We can certainly look into that and be able to address that next time.
Did you say at the start of the 83 how many had recovered?
Yes, 46.
Okay, thanks.
Okay, we have a few more additional remote questions coming in here. This is one from Beth Malicki from KCRG Channel 9. Why do daycares have to tell parents about, say, a pink eye outbreak in a classroom, but not necessarily a COVID-19 outbreak or a case of COVID-19?
I don't have an answer for that right now. I would have to check with Iowa Department of Public Health on what their reporting criteria are.
Okay, thank you. And here we've got another one from Zach Smith with the Press Citizen. Do you think the governor issuing a shelter-in-place order would elicit a more serious response from the public in terms of social distancing?
I don't know if I would be able to answer that from outside of a personal perspective, and I'm not going to answer it personally. I would just answer that I don't know if we would do a lot of different strategies that we're currently doing to slow this spread, and that's what we've all been saying and all been hearing about. Isolating ourselves when we're not feeling well, isolating ourselves from other individuals 6 feet, covering our cough, all of those things that we've been talking about. Whether there's a full shelter in place or all of the strategies that we're currently under, I don't know as if that would change our objectives at this point right now.
And then one last one here from Zach. Do state and local actors not owe it to the public for more transparency in terms of data they are using and the processes they are working with?
I think we've been very open with the information and processes and strategies. That might, again, be a question for our hospitals or the State Department of Public Health.
Thank you.
I'm Marissa with the Daily Iowan again. Since you're talking about the hospitalization rates, like in the county, and how that data is like at the hospital level, since that's one of the metrics that the IDPH is using to determine like whether a shelter in place would be necessary. I was just wondering like where Johnson County Public Health like falls within that line of communication, or what your role would be then in determining like the level of whether a shelter in place would be necessary here.
Well, again, I think I said earlier that we have constant communication with Iowa Department of Public Health. They have that information, I think, and they're the ones that would help guide that direction for us locally. Again, unless they're giving us local delegation, that shelter in place would either be regionalized or across the state.
But are hospitals then, like, do you know if they're reporting the data directly to IDPH to determine whether a shelter in place would be necessary, or?
Absolutely. The Iowa Department of Public Health has the information from all the healthcare systems across Iowa.
Okay, thank you.
All right, thank you.
All right, now we have Brad Kunkel with the Johnson County Sheriff's Office.
Good afternoon, everyone. Thanks for coming. I do have something short, kind of prepared, more of just a general PSA for everyone, and then be happy to take some questions. So, as Iowa makes its way into the spring and the air temps climb, most of us will feel the urge to go outside and enjoy the nicer weather. The deputies are already seeing a lot of this activity. This means that many people will seek to use the trails, the parks, and other open spaces in an effort to take a break from the isolation in their homes. The Sheriff's Office is just asking people to be mindful of their spacing when they're out in outdoor spaces and practice social distancing if you do decide to use one of our outdoor amenities. Now is certainly not the time to relax everything we've been doing, and we have to keep continuing to try and flatten that curve. And also, as more and more bicycles and motorcycles are out on the roads, we ask motorists that are out there to pay attention and watch for other people using the roads as well. Please make sure to give cyclists and runners enough room when passing and pay extra attention for motorcycles, particularly at intersections. And also, it's springtime in Iowa. That means the farmers are getting into the fields in preparation for planting season. So please watch out for tractors and other slow-moving vehicles that will be traveling the roads as well. And for those of us who drive on rural highways and gravel roads, please drive with caution and be prepared to encounter farm equipment during your travels. And just remember to give these vehicles enough room to operate and drive safely. With that, be happy to take your questions.
Emily Chavez with KGAN. Has there been an increase in calls regarding people just saying, hey, I see, a large gathering here at the park, or I've been seeing a large gathering here? We keep getting Facebook messages of, this place is still open, or, I'm starting to see this, people gather here, what can you do about it?
So I don't know about if I have a number to say if those calls have increased. What's really been interesting throughout the month of March is actually this pretty large decrease in overall calls for service that the JEC has received. You compare the numbers to kind of the first couple weeks of March to where we're at now, and there's been a pretty dramatic decline in overall calls for service. And even though we're only 3 days into April, we're down. The total call volume for April so far is down 44% compared to the same 3 days from last year. So those numbers do include officer-generated things like traffic stops, bar check, other self-initiated activity. But a large part of that, too, is just, in general, especially in the last 2 weeks, this pretty dramatic decline in overall calls for service.
And I'm not sure if you'll have the data on you at hand, but calls with domestic, we're told to be staying inside, and for some people that could be difficult if they're living with someone who's abusive. Have you been getting a lot of domestic-based calls, or?
So the feedback I'm kind of getting is, and I don't have a specific number, but the feedback I'm getting on calls in general is it's about the same number. We have had, I can think of one in particular where it was a problem related to a prolonged period of people being isolated together. It'll be interesting to really see those numbers after maybe a month or so. I don't have the specifics right now, but we are, at least at the sheriff's office, we are kind of tracking those to see where those are taking us. But give us another 2 weeks or so to have some actual good numbers for you.
Great, thank you so much.
You're welcome.
Marissa Payne from the Daily Iowan. I know you spoke about this last week a little, but can you provide an update on the population that's being held in jail right now, and continued efforts to keep those numbers down?
Sure. So right now our population is at 22 in-house. Sounds like we have another inmate being released sometime to go to another facility this afternoon, and we also still have 10 out of county. The efforts that are out there to reduce that population are really just more practices that local law enforcement on the street are just continuing to do to exercise discretion. Think about those instances that, is this a situation where an arrest needs to be made? But we're also really thankful for the action that the court system has taken to help just reduce that population overall. So we're still doing everything we can to limit the people coming into jail.
Thank you.
You're welcome. Okay, thank you.
Welcome, everybody.
To wrap things up, we have Dave Wilson with Johnson County Emergency Management.
Afternoon, everybody. Welcome. So this is like day 27 or 28 of our response. I just wanted to kind of talk to you globally about where we're at on some of this. So as you know, we were the first case in Iowa, and with that, we started ramping up right away. That Sunday night, and then Monday with the incident command team at Johnson County Public Health, and then Tuesday with the EOC. It's hard to believe that we're like 28 days literally into this, but the effort continues to be a pretty unified effort, and we deal with a lot of partners. And those partners are from everybody from the National Guard to the hospitals to the guys delivering supplies that come in and out of here every day, the politicians. We all still have a focus though, right? And that focus is, though, even that we're at the 28-day mark and the numbers are kind of not going crazy in Johnson County, we all still have a social responsibility. So, there's a lot of talk about metrics and shelter in place and all those things. The effect is that we decide what's going to go on. We have personal responsibility as Iowans and as Johnson County folks. Regardless of what an order is or what metrics are used, we have a responsibility to not come to work and spread germs. And it doesn't matter if that's whatever disease. That's your personal responsibility. I don't need a law to tell me that, and I don't need an order to shelter in place to tell me that. So we really started focus on that message early on. All those mitigation strategies and all those things we want people to do to protect the most vulnerable people. And I think we've been pretty successful as a city, county, and state on that. I know there's a lot of pushback over that, and it's unfortunate because we're all trying to do the right thing, the right thing for people of Iowa and citizens. And I think our goal is always to save lives, right? And everybody's goal and focus is doing that. Well, it starts with personal responsibility. So we can only use tools, data, and metrics to do so much. But at the end of the day, it's those decisions that we make as people that are going to make the most impact. And we've seen good support from that. On the coordination and resource side, I'd talk about, supply chain. Everybody in the world is fighting the supply chain. Everybody. And so we luckily were a little more prepared than most counties. We had a ton of equipment that we had on hand. I publicly reported, over 17,000 masks that we started out with. Today we've issued out over 22,880 either N95s or KN95 masks. We've got 41 ventilators here in the county. 9 of those are presently assigned to Mercy. The rest are going through some stage of preventive maintenance or biomed calibration. So we're in a pretty good position. And you've seen that because everybody's focused on the mission, right? Whether you're one of the 3 hospitals in this town or you're one of the 2 up the road, whether you're a nursing home in this county or you're an average citizen, everybody's focused on doing the right thing. And that really should be the message. So with that, I'll kind of get off my soapbox and start taking questions. Travis, you seem to want to go first. Go ahead, sir.
I've seen some stores doing things like online orders only that they come drop off to you. Some stores staying open but trying to, like, posting signs say, like, wait for the cashier to call you. I mean, do you have an opinion on those measures, and could there be any kind of uniform enforcement as far as, like, all stores have to follow this?
So the uniform enforcement part's tough, right? I saw an email this morning from Home Depot, and it was one of those broad ones that said, we're pivoting on how we're delivering our business model. And they were going to, try and control access to how many people were in their store at one time. I think that's great. If you grew up in a hurricane state, you're used to seeing that. They only allow so many people in at one time, things like that when there's the rush. I think anything that a business can do to make sure that we're socially responsible and operating in a more safe manner is really helpful. The enforcement has to start with us. There's only so many cops, there's only so many National Guardsmen. You can't lock it all down, and at the end of the day, you can't throw everybody in jail. So it really comes down to personal accountability and socially responsible things. And I think we've seen that from a lot of businesses, and I applaud them on their efforts. The ones that, can say, order online, we'll send you a text and we'll deliver it to your car or pick it up here. I applaud those activities because we do have to keep the economy moving. We do have to keep the supply chain moving. We just need to do it smarter and differently. And I think that starts with everyone. That's a personal accountability thing. So businesses that have done that, I think that's great, and I support it.
That's all I have for right now. Thank you.
Okay, thanks, Travis. Emily, anything from you, ma'am? Okay. Other folks? Lee? Nothing? I think I forgot to get back to you, or did I get back to you the other day? You had a question about something.
We're good.
Okay, we are good. All right, thanks. Other questions? Yes, ma'am.
Hi, Marissa Payne from the Daily Iowan.
Yes.
Since the IDBH data to determine shelter in place, relies on like data on the number of cases and things like that, are you concerned then about underreacting because of testing not being available enough on a widespread
I'm not
basis?
concerned about underreacting. I'm concerned about socially responsible and responsible reacting. I think it's everybody's responsibility to look at the numbers logically, thoughtfully, look at those metrics and know everybody doing this job that I've interacted with, whether they're in Linn County or Johnson County or the Iowa Department of Public Health, they're trying to do the right thing. And there's a lot of data coming at us and a lot of tools. And those tools that you guys have referenced are just that. They're the metrics and the tools that the State Department of Public Health looks at. We have conference calls every day with long-term care centers to look at what's their staffing, who's sick, do we have outbreaks, where's their PPE. We do the same thing with hospitals. We do the same thing with private businesses, Systems Unlimited, the line goes on and on. So we're all kind of focused on that, and we're all trying to do the right thing. I think the deal is there's only so many tests available, right? And so we know that there's a lot of folks out there that could have it that haven't been tested. We're trying to plan for the known and what we have right now and look ahead to what could be. We're watching, what's happening in other places, and that's the reason you see all these preparedness activities. That's why you see us surging up on vents. That's why you see us having discussions on what we would do in mass fatality if we had to do alternate care sites. I mean, that's our job, is to think worst case scenario, what if? And so we're trying to do that, and don't think we're not. That is going on. I assure you is going on. We're gaming the heck out of this thing. So to write a narrative or tell a story that somebody's got their head in the sand, that is just not true. Absolutely not factual. Does that answer your question, ma'am?
Mm-hmm.
Sorry, that was a long-winded response.
No, you're good. Thanks. And I had another question.
Yes, go ahead.
In regards to long-term care facilities, I know, as Dave Coach mentioned, there's not currently any outbreaks in the county at those facilities. So what are you all continuing to do to make sure it stays
We're continuing to
that way?
preach every morning on our 10 a.m. call with them the mitigation strategy of here's the best practices as a risk manager that you can do to make sure you keep the germ out. We identified early on the first week, these are our strategies and our tactics we're going to try and enforce. We don't have a lot of sticks, right? There's only so much stuff that we can do. But as a business, those business owners, those long-term care facilities understand they don't want to be life care. They understand that they don't want to be on the national news. They are trying diligently to keep their patients healthy and happy. And they are trying extraordinarily hard to keep their employees safe and healthy. So they are laser focused on that. I can tell you, we talk to them 7 days a week, 10 a.m., and everybody in Johnson County is on there, has a representative on that. And if they're not, they're always invited to be on. Some days they miss. But they are taking active measures to make sure their people don't get sick. And when they do have one get sick for an influenza or something like that, they make sure that they, get that place clean right away. Does that answer your question?
Yeah, thanks.
Okay, thanks, ma'am. Brad, do we have anybody on the line? Beth Malicki or anybody? Anybody's got anything? Yes,
Joseph
sir.
Kress, Iowa City Press Citizen.
Yeah, go ahead.
Do you feel you're being fully transparent with all the data you're receiving legally?
I do, and I really bristle, and it upsets me when I hear us being challenged about that. I think what you see on the Iowa Department of Public Health's website is incredibly transparent. They put the information on there based on the data dumps they get. The thing you have to understand is this changes constantly. I'll get an email as soon as I walk out the door and something will have changed. It's very dynamic moving. We had a discussion this morning, just anecdotally, about how we were going to do some reporting. And we all agreed upon it. And then a couple hours flash forward, a memo comes out that it's changed and it's being done this way. We have to react to that. But I think people are trying their hardest to be transparent and be upfront with the realization that this could be you that we're talking about that has a disease, and you might not want that information out there. So we are still bound by HIPAA and privacy things, and if people choose to do things and self-report, that's on them. We obviously want them to be thoughtful before they do that, because there can be negative ramifications. But I think within the bounds of the law and the ethically and morally right things to do, we've tried, or at least everybody on this team down here in Johnson County has tried to be as transparent as they possibly can. So it makes me uncomfortable when I hear that we're not. Does that answer your question, sir?
Yeah, thank you.
Okay,
I appreciate
thank you. Emily, did you have anything, ma'am? Okay. Travis, anything? You're good? Okay. Lee?
Good, thank you.
Okay, all right. Thanks, everybody. Have a good Friday. Oh, I'm sorry, ma'am. Go ahead.
So since the county supervisors are still maintaining their recommendation for a shelter in place, but, you know, as you're kind of urging social responsibility and people to make that call themselves without a shelter in place, then, like, does that suggest that public health officials are, like, not supportive of the county supervisor's recommendation?
I don't think anybody said that at all. The political leaders have their perspective on things, and they've listened to all of us, and nobody's told them not to send that. You know, everybody's trying to do the right thing. I go back to that over and over again. Everybody's trying to do the right thing. They sent that letter based on the beliefs that that would be effective, and we're absolutely supportive of anybody that has a belief that we can do something more to be supportive and be effective. They sent that letter. It's at the governor's office. What comes of that is what may. But for instance, you know, Minnesota was reported that they have a shelter-in-place order. Well, by the time you look at all the people that are critical infrastructure, key resources, and exemptions, there was like 70-some%, I think it was, of the people that are considered exempt from that rule. If you look at what the governor's done, I'm supportive of what she's done. You know, it was kind of a stair-step approach, right? She closed businesses that were large gatherings. I mean, she did it in a logical, methodical way. And I think it was calculated based on the best interests at the time. And I think you've seen that move up and ratchet up. The thought that anybody is trying to do something that is contrary to the public good is absolutely the false narrative. Everybody that I deal with, whether they're state, local, or county, is trying to do the right thing and save lives. And that is our mission. And I don't see anybody doing anything contrary to that. Now, they might have different perspectives on how to get that done, but I'm not sure what the outcome would be if you issued a shelter in place. You know, you've still got to have people go to work, make products to deliver. I've still got to have the FedEx guys come deliver N95 masks. I mean, all those things are key to our supply chain to keep the hospitals going, to keep the paramedics respond to calls. Those things still have to happen. At the end of the day, what should happen is people need to say, do I really need to go out? Is there a better way for me to handle this? And really, that social responsibility is, you can write all the laws and all the rules in the world. If people don't take some social responsibility and follow those rules, then that's when we have problems. So at the end of the day, you know, we need to look at ourselves and go, am I doing the right thing? Because at the end of the day, that's who causes an issue, right? All right. Does that answer your question?
Yeah.
Sorry, I get a little winded on some of these responses. My apologies. Anybody else? Okay. Thanks, Travis. You all have a good weekend. Oh, locked in.
That concludes our press conference for today. Thank you all again for coming and for those who are tuning in, and to our community partners. Our next scheduled press conference is Tuesday at 1 p.m., and we will send information early next week.